Hello guys! In this lesson, I would like to talk about common nail diseases. If you want to be a professional, you need to know when you can work on the client hands and when you can refuse the service. There are a number of conditions that can affect our nails with different causes and treatments. Nail problems affect people of all ages. Diet is generally not responsible for abnormal nail changes unless the person is suffering from severe malnutrition. Some nail conditions need professional treatment from either a doctor or a dermatologist, while others respond to simple self-help techniques and minor lifestyle changes. When you're in doubt, please seek medical advice. I will show you some pictures with abnormal nails. Some of them are a little scary, so don't be surprised. We're professionals, so we need to know the most common nail problems. Let's go, guys. Nail discoloration, in which the nail appear white, yellow, or green, can result from different infections and conditions of the skin. Causes of discolored nails typically include nail polish, nicotine from cigarette smoking, hair coloring agents, injury to the nail bed, some medications including antibiotics, melanoma, which is the type of skin cancer. Several things can cause very thick or crumbling nails. They can be caused by injuries or pressure from shoes. Fungal infections are a common cause. Diabetes, psoriasis, or vascular disease are other possible causes. Dry and brittle nails are the result of too little moisture. They are most commonly caused by the repeated washing and drying of fingernails. On the other hand, soft and brittle nails are caused by too much moisture, often a result of overexposure to detergents, household cleaners, and nail polish remover. Lines running from the bottom of the nail to the tip are the most common form of ridges in fingernails, affecting about 20% of adults. Often it's just a sign of aging. Fingernails are made mostly of keratin, a protein also found in the hair and outer layer of skin. In the same ways that the skin gets drier and the hair feels rougher, the nails also change with age because the body has a harder time retaining moisture. A split nail is usually caused by physical stress, nutrient deficiency, or wear and tear. Split nails can be a problem, especially if you work with your hands. So what's the causes? It can be constantly wet hands, especially while using soap and washing detergents. Frequently using and removing nail polish. Continuous mild trauma, such as a habitual finger taping or using the nails as tools, for example, picking between the teeth. Bacterial infection of the nail. The Staphylococcus aureus bacterium is a common cause of bacterial infection of the nail. The infection will usually start in the fold of skin at the base of the nail. It's also called proximal nail fold. Without treatment, the infection can get worse and lead to inflammation and pus. Paronychia is a skin infection around the fingernails or toenails. It usually affects the skin at the base, which is cuticle, or up the sides of the nail. Typically, paronychia begins with pain, swelling, and redness around the base or the sides of the nail. Let's see the causes. Irritated and injured skin. Germs get into the skin. Biting, chewing, or picking the nails. Ingrown nail or constantly wet hands. Onycholysis is the nail separation from the skin underneath. This condition lasts for several months because a fingernail won't reattach to the nail bed. Once a new nail grows to replace the old one, the symptoms should resolve. Fingernails take 4 to 6 months to fully regrow. The affected nail might become yellow, greenish, purple, white, or gray, depending on the cause. So, what causes onycholysis? It can be injury, allergy to the products like chemical nail polish remover or artificial nail tips. Also, it can be as symptoms of nail fungus or psoriasis. Fungal nail infections are common infections of the fingernails or toenails. The nail might become discolored, thick, also it can crack and break. Infection is more common in toenails than fingernails. The technical name for a fungal nail infection is onychomycosis. People with diabetes or with weak immune systems are at the higher risk of fungal infections. Causes: the nail plate can lift from nail bed, thick and crumbled nails, or discoloration. Clubbing nails: it's changes in the areas under and around the fingernails that occur with some disorders. The tips of the fingers enlarge and the nails become extremely curved from front to back. Nail clubbing can be a result of low oxygen in the blood and a sign of various types of lung disease. Nail clubbing is also associated with inflammatory bowel disease, liver disease, and AIDS. Melanonychia is a condition of the fingernails or the toenails. Usually it is a black or brown stripe that starts at the bottom of your nail bed and continues to the top. It might be in one or several nails. These lines can be a natural occurrence if you have a dark complexion. No matter what the cause might be, you should always have a doctor check any melanonychia. So we have two types of melanonychia. The first one is melanocytic activation. The causes is pregnancy, trauma, nail biting, nail infection, psoriasis, or skin cancer. And the second one is melanocytic hyperplasia. And the causes can be lesions, usually benign, moles or birthmarks, usually benign, or cancer of the nail plate. Skin diseases such as psoriasis and eczema, dermatitis, can affect the nails. Abnormalities might include pits, grooves, or crumbling nails. Some diseases that can affect the shape, integrity, and color of the nail include lung disease, heart disease, kidney disease, liver, or thyroid disease. Older age and nails. When people get older, their nails grow much slower. The change of protein in the nail plate can cause brittle and split nails, discolored and thick nails as well. Diagnosis and treatment of nail problems. Any abnormal changes to the nails should be medically investigated. See the doctor for treatment or possible referral to a dermatologist. If the cause of the nail problem is not immediately apparent, the doctor might take nail clippings and scrapings from beneath the nails for laboratory analysis. Fingernail infections usually respond faster to treatment than toenail infections. Depending on the cause, treatment might include: it can be antibiotics for bacterial infections or antifungal preparations, mainly oral tablets for nail fungal infections, or you can take advice on appropriate nail care. And here's some self-help strategies for healthy nails. There are some ways to reduce the risk of nail problems. So tell your clients to practice good personal hygiene, wear protective gloves for wet jobs, such as washing the dishes. Avoid harsh chemicals, such as strong soaps and detergent. Don't clean under your nails too often or too aggressively. Don't bite your nails or don't smoke. You need to moisturize your hands, especially after washing them. And remember to rub the moisturizer over your nails and cuticles as well. Okay guys, we're done with the common nail diseases and I will see you in the next video.